Let me ask you something very honestly. How many times did you get up last night to use the bathroom? Once, maybe twice, maybe more. And when you were done, when you stood up, adjusted your clothes, and walked away, actually feel finished? Or did something still feel incomplete? Like there was just a little bit left? Not enough to worry about, not enough to talk about, but enough that 10 minutes later, you were thinking about going again. I've had men sit across from me in my office, look me straight in the eye and say, "Doctor, I don't understand it." I go, and then I feel like I didn't really go, and then they laugh it off. They say it's just age, right? But here's the truth most people never hear. That feeling, that subtle sense that something is still there, is not something you should ignore, because your bladder is not supposed to work that way. When it empties, it should empty. Not halfway, not almost, completely. But what I see over and over again, especially in men over 60, is not a bladder problem. It's a control problem, a hidden tension problem, a problem you cannot see, and most people don't even realize they have. And the worst part? Most of the advice you've probably been given is making it worse. You've probably heard of Kegel exercises, tighten, hold, strengthen the muscles. Sounds logical. Sounds like the right thing to do. But what if I told you that for many men in your situation, those exact exercises are the reason things aren't improving? What if I told you that the more you try to tighten, the harder it actually becomes for your body to let go? Because that's what this is really about. Not strength, not weakness, but the ability to release, to let your body do something it was designed to do naturally, but has slowly forgotten how to do over time. And if that sounds strange or even a little hard to believe, I understand. Most people don't realize this until they feel it for themselves, until they experience, for the first time in years, what it actually feels like to fully empty their bladder. No hesitation, no second guessing, no walking away and wondering if you need to come back. Just done. And today, I'm going to show you exactly how to get there. And this is where I need you to pay very close attention. Because what you're feeling right now, that slight hesitation, that incomplete emptying, it doesn't stay the same, it slowly gets worse. Not overnight, not in a way that alarms you, but in a way that quietly changes your routine, your comfort, your confidence. At first, it's just one extra trip to the bathroom, then it becomes two. Then you start planning around it. You begin to notice where the nearest restroom is whenever you go out. You hesitate before long drives, you think twice before sitting through a movie, and eventually, without realizing it, your world starts to shrink. Not because you want it to, but because your body is no longer predictable. Now here's the part most people misunderstand. They think this is a bladder problem. They think the bladder is getting weak, but in many cases, that's not what's happening at all. What's actually happening is that your bladder is not being allowed to empty properly, and when urine stays behind, even in small amounts, it creates a very different environment inside your body. Think of it this way. Your bladder is designed to fill and then completely release. That cycle matters, because when it doesn't fully release, that leftover urine becomes a source of irritation. Pressure builds, signals become confusing. Your body starts telling you to go again, even when you just went. And over time, this can lead to something even more frustrating: urgency. That sudden, uncomfortable feeling that you need to go right now, even if your bladder isn't actually full. I've seen men who can't sit through a conversation without that feeling creeping in, men who wake up 3, 4, 5 times a night. Not because their bladder is full, but because their body has lost its sense of completion. And then there's something else, something most people never connect to this. Tension, chronic invisible tension in the pelvic floor, muscles that are supposed to relax, but don't. Muscles that stay slightly contracted all day, while sitting, while standing, even while trying to urinate. So what happens? You go to the bathroom, your bladder tries to empty, but the muscles that are supposed to open don't fully let go. So the flow slows down, stops early, leaves something behind, and your brain registers that as unfinished. And the cycle repeats, again, and again, and again, until one day you don't even remember what normal used to feel like. You just accept it. You tell yourself, this is part of getting older. But it's not that simple, Because I've seen men in their 70s and 80s regain normal function once they address the real issue. And I've seen men in their 52nds continue to struggle because they were focusing on the wrong thing. So no, this isn't just about aging. And it's not just about your bladder. It's about something deeper. Something most people never think about until it starts affecting their daily life. Now, let me speak to you not just as someone explaining a concept, but as a physician who has seen this pattern again and again. Over the years, I've had countless men come into my office with the exact same complaint. They don't use the same words, but they describe the same experience. I go, but I don't feel done. I wake up multiple times at night. I feel pressure, but not relief. And almost every single one of them has already tried something. They've looked it up. They've followed advice. And more often than not, they've been told to do one thing. Kegel exercises, tighten the pelvic floor, hold it, strengthen it. And on the surface, that makes sense. Because for a long time, the conversation around pelvic health has been very one-sided. Weak muscles need strengthening. That's the assumption. That's what most people are told. But here's what I've learned through actual clinical experience. Not all pelvic floor problems come from weakness. In fact, in a large number of men over 60, the issue is the opposite. The muscles are not too weak, they are too tight, too engaged, too used to holding and not releasing. And when you take a muscle that is already holding tension and you tell it to contract even more, you don't fix the problem, you reinforce it. Telling someone with a clenched fist to squeeze harder, at some point the issue is no longer strength, it's the inability to let go. And that changes how we approach everything. Because now we're not talking about building force, we're talking about restoring balance, coordination, timing, the ability for your body to switch between holding and releasing at the right moment. And when that balance is lost, you start to see exactly the symptoms we talked about: incomplete emptying, frequent urination, nighttime disruption, that constant awareness in the background that something isn't quite right. So when someone tells me they've been doing Kegels for months and nothing has improved, I'm not surprised, because they've been working the wrong side of the system, and until you address the part that actually needs attention, nothing really changes. So this is the moment where everything needs to shift. Because if what you've been doing hasn't worked, it's not because your body is failing you. It's because you've been given the wrong tool for the job. And I want to be very clear when I say this. If your pelvic floor is already tight, if those muscles are already holding tension without you realizing it, then doing more Kegels can actually make your symptoms worse, not better. Worse, you may feel like you're working on the problem. You may feel like you're being proactive, but what you're really doing is teaching your body to stay in a constant state of contraction. And a muscle that cannot relax, cannot function properly, especially when it comes to something like urination, which depends on release, not force. So instead of trying to tighten more, what you actually need to learn is how to let go, how to reverse the pattern your body has been stuck in, how to retrain those muscles to drop, to open, to release at the right time. And this is where everything changes, because the moment you stop focusing only on strength and start focusing on relaxation and coordination, your body responds differently. The flow changes, the pressure changes. That feeling of not quite done begins to disappear. And the exercises I'm about to show you are designed specifically for that. Not to force your body, but to guide it back to what it was meant to do naturally. Now let's start with the first exercise. And I want you to understand something before we begin. This is not about forcing anything. It's about changing the way your body naturally empties. So the next time you go to the bathroom, I want you to slow down. Don't rush. Don't treat it like something you need to get over with quickly. Sit down fully. Make sure your feet are flat on the ground, your thighs supported, your back straight, but not stiff. Relaxed. Not leaning, not straining, just sitting. Now, begin urinating as you normally would. Don't push, don't try to speed it up, just let it happen. And as the mainstream begins to slow down, this is where most people stop. They assume they're done, they stand up, and that's exactly where the problem starts. Instead, I want you to stay seated, take a slow breath out, and gently lean your upper body forward. Not a big movement, just enough that your chest moves slightly toward your thighs. As you do this, You may feel a subtle pressure shift in your lower abdomen, almost like something is being guided downward. Hold that position for a few seconds. Keep breathing. Stay relaxed. And notice what happens. For many men, this is the moment where a second flow begins. Not forced, not pushed, just released. Now slowly return to an upright position. Pause. Let your body settle. Give it a moment. And then, gently lean back. Again, not exaggerated. Just a slight opening of your chest, as if you're creating space in the front of your body. And this is important. When you lean back, don't arch your lower back aggressively. Keep it comfortable, controlled. As you breathe in, you may feel a different kind of release, a subtle opening in the pelvic area. And again, sometimes more comes out. Now return to neutral. Sit still. Wait. And then repeat the cycle. Forward. Pause. Back. Pause. Each time, you're giving your body another opportunity to fully empty, not through force, but through positioning and relaxation. Do this slowly. 4 to 5 cycles is enough. There's no need to rush, because what you're doing here is retraining your body to finish what it started. And I want you to pay attention to something. Not just the physical result, but the feeling, the difference between getting up too early and actually being done. That sense of completion, that quiet moment where your body no longer signals anything, that's what we're aiming for. And once you feel that, even once, you'll understand how much you've been missing. Now that you've begun to understand what it feels like to allow your body to release, we're going to take that one step deeper, because what happens in the bathroom is only part of the picture. What really determines how well your bladder empties is the condition of the muscles surrounding it the rest of the day. And for many men, those muscles never truly relax, so this next exercise is designed to do exactly that, to gently open and release the pelvic floor. Find a quiet space, somewhere you can lie down comfortably. You can use a mat, a carpet, even your bed. Lie on your back. Let your legs extend for a moment. Let your body settle. And before you move, just take one slow breath in and let it out. Now bend your knees and slowly draw them toward your chest. Don't rush this. Bring them in as far as feels comfortable. If reaching your feet is easy, you can gently hold them. If not, simply hold your shins just below your knees. Either is perfectly fine. Now, slowly guide your knees apart. Let them move outward toward your armpits. You're not forcing them, you're allowing them. Your hips begin to open, your lower body begins to soften, your feet can face upward, your back stays grounded, and this is important. Keep your lower back gently connected to the surface beneath you. No tension, no strain. Now bring your attention to your breath. As you inhale, let your belly rise. Let the air move downward, not into your chest, but into your abdomen, your lower pelvis. And as you exhale, I want you to imagine something very specific. Imagine the muscles at the base of your pelvis, softening, dropping, letting go, not pushing, not controlling, just releasing. And for many men, this is unfamiliar, because this area has been holding tension for years. So don't worry if you don't feel much at first. Stay with the breath. Inhale, expand. Exhale, drop. After a few breaths, you can add a gentle movement. As you inhale, allow your knees to drift slightly wider, and as you exhale, let them come back in just a little. A slow, wave-like motion, nothing forced, just movement guided by your breath. And as you continue, something begins to change. The hips loosen, the inner thighs soften, and deeper than that, the pelvic floor begins to let go in a way it hasn't in a long time. Stay here for 1 to 2 minutes. If it feels comfortable, extend to 5. There's no rush. This is not about repetition. It's about allowing your body to remember how to relax. And when you're ready to come out of the position, bring your knees gently back together, roll onto your side, and take your time sitting up. And just notice that subtle feeling of lightness, of space, of less pressure. That's the direction we're going. Now we come to the most important part of everything I'm showing you today. If there's one thing I want you to truly understand and practice, it's this. Because this is where most men get it wrong, and this is where everything can begin to change. This exercise is called the reverse Kegel, and despite the name, I want you to forget everything you think you know about Kegels for a moment. Because this is not about tightening, it's not about squeezing, it's not about holding it in, it's the opposite. It's about learning how to release on command. Now here's the challenge. Most men have never been taught how to feel this area of their body properly. You can feel your arms, your legs, your chest, but the pelvic floor, for most people, is almost invisible. You don't notice it until something goes wrong. First step here is awareness. Lie down on your back. Use a pillow to support your head and shoulders. Bend your knees and let them fall outward comfortably. You can bring the soles of your feet together if that feels natural, or keep your feet supported with cushions. The goal is simple: comfort, no strain. Now place one hand on your lower abdomen, just below your belly button, and if you feel comfortable doing so, place your other hand gently on the area between the scrotum and the anus. This is the region we're focusing on. Now, before we begin, I want you to check something. Give a small natural cough, just once, and notice what happens under your fingers. You should feel a quick contraction, a subtle lift or tightening. That's your pelvic floor. That's what most Kegel exercises train. But now, we're going in the opposite direction. Take a slow breath in through your nose, and this is important. Don't lift your chest. Don't take a shallow breath. Let the air move downward, into your belly, into your lower abdomen. And as you inhale, want you to imagine that the breath is gently pressing downward into your pelvis. Not forcefully, not pushing, just expanding. You may feel your belly rise under your hand, and if you're paying close attention, you may feel a very subtle outward pressure beneath your other hand. That's the beginning. Now as you exhale, don't squeeze, don't contract. Just let everything soften. Let it fall, let it release. And this is where many people make a mistake. They try to do something, but this is not about doing, it's about allowing. Inhale, gentle expansion downward. Exhale, complete relaxation. Again, slowly. And as you repeat this, I want you to start noticing the difference between tension and release. At first, it may be very subtle. You may not be sure if you're doing it correctly. That's normal, because this is a skill, and like any skill, it improves with attention. Now here's how you know you're doing it right. There is no strain, no tightening, no holding of the breath. Your face stays relaxed, your shoulders stay relaxed, your abdomen moves naturally with your breathing, and most importantly, there is a sense of softening in the pelvic area. Not force, not effort, softening. If you feel yourself tightening, if you feel your muscles pulling upward, you've gone back into a regular Kegel. And that's not what we want here. So pause, reset, and begin again. Slow breath in. Allow the body to expand downward. Slow breath out. Allow everything to release. Continue this for 2 to 3 minutes. That's enough. You don't need more. What matters is quality, awareness, connection. Because what you're doing here is retraining a pattern your body has held for years. You're teaching it that it's safe to let go. And when this begins to translate into your daily life, something remarkable happens. You go to the bathroom, and your body doesn't hesitate. It doesn't hold back. It doesn't stop halfway. It completes the process, naturally, without force. And that is the goal. Not control through effort, but function through release. Now we come to the final piece of this system, and this one may seem simple, but it's often the missing link. Because everything we've talked about so far, your bladder, your pelvic floor, your ability to release, is not just physical, it's neurological, it's controlled by your nervous system. And if your body is in a constant state of tension, your muscles will reflect that, even if you're not aware of it. Many men I see have one thing in common: they don't truly relax. Even at night, they lie in bed, their mind still active, their body still slightly on edge, and that state keeps the pelvic floor from fully letting go, which is why they wake up, not always because the bladder is full, but because the body never fully settled. So this exercise is about teaching your system how to shift from tension to calm. Lie down comfortably. You can bend your knees slightly if that feels better for your back. Place one hand on your chest and the other on your belly. Now take a slow breath in through your nose, and I want you to notice something. Which hand moves more? If your chest rises first, you're breathing shallow, and shallow breathing keeps your body in a more alert state. Instead, guide the breath downward. Let your belly rise. Let your lower abdomen expand. Your chest should stay relatively quiet. Now exhale slowly through your mouth, as if you're gently blowing out a candle. No force, just control. And as you exhale, feel your body sink a little deeper into the surface beneath you. Again, slow inhale, belly expands, slow exhale, everything softens. Now, if you want to deepen this even further, you can use a simple rhythm. Inhale for a count of 4, hold gently for 4, exhale for 4, and pause again for 4. A steady, even pattern, no strain, just rhythm. And as you continue this, your nervous system begins to shift, your heart rate slows, your muscles release, and most importantly, the pelvic floor follows. Stay here for a few minutes, especially at night, right before sleep, because when your body truly relaxes, everything else begins to work the way it's supposed to. Now let's bring everything together, because knowing the exercises is one thing, but knowing how to use them in your daily life, that's what creates real change. I want you to think of this as a simple routine, not something complicated, not something that takes a lot of time, just a sequence your body can learn and repeat. Start with the moment you go to the bathroom. Don't rush. Use the first technique we talked about. Sit properly, allow the flow to happen, and when it slows down, take those extra moments. Lean forward, pause, lean back, pause. Give your body the chance to fully finish. That alone can begin to change the pattern. Then, at some point during the day, or in the evening, take a few minutes for the second exercise. Lie down, open the hips, let the pelvic area release. This helps undo the tension that builds up from sitting, from stress, from holding throughout the day. After that, practice the reverse Kegel, just 2 to 3 minutes. Slow breathing, gentle awareness. This is where the real retraining happens. You're teaching your body a new pattern. And finally, end with the breathing exercise, especially at night, right before sleep. This is what tells your system it's safe to relax, safe to let go, safe to reset. You don't need to do everything perfectly. You don't need long sessions. What matters is consistency. A few minutes, every day. Done with attention. That's what brings your body back into balance. Now, I want you to understand something very important. This is not a one-size-fits-all situation. Your body has its own patterns, your own habits, your own history, and the way this shows up for you may be slightly different from someone else. So let me help you make this more personal. If you're someone who wakes up multiple times at night, then your focus should be on what you do before bed. The breathing exercise becomes essential. Slow your system down. Give your body a chance to fully relax before you sleep. If your issue is more noticeable during the day, frequent trips, that constant awareness, then bring more attention to the first exercise. Don't rush when you go. Those extra 30 seconds can make a bigger difference than you think, and if you've spent years sitting for long periods, working at a desk, driving, staying in one position, then the second exercise becomes even more important, because that tension builds quietly over time. Now here's the key. Don't try to fix everything at once. Start with what feels most relevant to you. Stay consistent, and pay attention. Your body will tell you what's changing, if you give it the space to respond. Now I want to take a moment and be very clear with you, because while these exercises can make a real difference, they are not a cure for everything. If your symptoms are mild, if what you're experiencing is that sense of incomplete emptying frequency or tension, then what we've gone through today can be extremely effective. But there are situations where you need to look deeper. If you're experiencing pain when you urinate, if you see blood in your urine, if the flow is extremely weak or suddenly changing, or if you feel a constant pressure that doesn't improve, those are not things to ignore. Those are signals that require proper medical evaluation. And I say this not to alarm you, but to make sure you're approaching this the right way. Because part of taking control of your health is knowing what you can improve on your own and knowing when to seek help. What we're doing here is restoring function, improving coordination, helping your body return to a more natural state. But if there is an underlying condition, that needs to be addressed directly. So use this as a foundation. Pay attention to how your body responds. And if something doesn't feel right, don't wait. Get it checked. That's not weakness. That's responsibility. Let me leave you with something to think about. Because this isn't really about your bladder. It's about control. Not control in the way most people think. Not forcing your body, not fighting it, but being able to trust it again, to go through your day, without that constant awareness in the background, without wondering where the nearest bathroom is, without that hesitation before you stand up, or before you leave the house. Because I've seen what happens when that trust starts to fade. Men who begin to limit where they go, how long they stay, what they're willing to do, not because they want to, but because their body has become unpredictable, and little by little, their world gets smaller, quieter, more controlled by something they never expected to think about. And here's the truth, it doesn't have to go that way. Because what you're dealing with in many cases is not permanent damage, it's a pattern your body has learned over time, and anything that is learned can be changed step by step, breath by breath, moment by moment, until one day you go to the bathroom, and for the first time in a long time, there's no second thought, no hesitation, no return trip, just done. And that moment is more powerful than most people realize because it means something simple, but deeply important. You're back in control. If what I shared with you today made sense, I want you to do one simple thing. Try it. Not tomorrow, not next week, tonight. Pay attention to what your body does differently. And if you notice even a small change, I'd like you to come back and share it, because there are thousands of other men dealing with the exact same thing, and your experience might be what helps them finally understand it. If this helped you, make sure you stay connected. There's a lot more your body is trying to tell you. And most people never learn how to listen through repetition, not intensity, not force, but gentle, consistent signals that say, it's okay to let go. And over time, those signals begin to stick. Your system begins to trust them. And that's when real change happens. Not instantly, but steadily, and most importantly, naturally. I want you to remember something tonight, before you go to sleep. Your body is not working against you. It never was. Even on those nights when you wake up over and over again, even when you feel frustrated, tired, maybe even a little defeated, your body is not failing. It is trying to protect you, trying to respond to signals it believes are important, trying to keep you safe in the only way it knows how. The problem is not that your body is broken. The problem is that it has been holding tension for so long, it no longer remembers what true relaxation feels like. And when something is held long enough, it starts to feel normal. Tight hips feel normal. A clenched jaw feels normal. A restless night feels normal. But normal does not always mean healthy. And the moment you begin to question that, the moment you give your body a different experience, something shifts, not dramatically, not all at once, but quietly. Your breath slows, your muscles soften, your system begins to trust that it doesn't have to stay on guard anymore. And in that moment, something very simple returns. Not effort, not control, but rest. The kind of rest your body has been asking for a very long time. So tonight, don't try to force sleep. Don't chase it. Just create the conditions and let your body do what it was always designed to do. Because deep down, it still remembers. If you've made it this far, I want to ask you to do something simple. Try this tonight. Not perfectly, not for an hour, just 10 minutes. Follow the steps you just learned. Breathe. Slow down. Let your body feel what it's like to truly relax again. And then come back tomorrow and tell me what you noticed. Did you wake up less? Did your body feel different? Did something shift, even slightly? Because sometimes change doesn't start with something dramatic. It starts with one quiet night. That feels just a little better than the one before. And if you know someone who struggles with sleep, someone who wakes up every night and thinks it's just part of getting older, share this with them. It might be exactly what their body has been waiting for.